The last technique I'm going to discuss for brow lifts is called the direct brow lift. So why is it called the direct brow lift? Because the incision's directly above the brow. So why would you want to put an incision directly above the brow? So again, very patient specific, determined during your thorough consultation. And this type of patient who would be a candidate for a direct brow lift is someone, let's say, who has one brow that is in its perfect position on one side and the other brow for some reason medically, the nerve, you had a nerve injury to that area and the brow has descended. You've aged asymmetrically and one brow is lower than the other. So the type of person and patient who is a great candidate for a direct brow lift is somebody who has one brow that has asymmetrically aged quicker, or again from some sort of previous experience compared to the other brow. So they're going to be a good candidate for this, because why make an incision, large type of incision in the forehead or in the hairline to just lift one side so much, which we still do. But again, a direct brow lift, incision directly above the brow. Also, it's not that uncommon as you would think, because also you're making the incision directly above the brow. You obviously have the most control in that area to be able to manipulate the brow and set it where you want, because you're working directly on the brow in a direct brow lift. Other candidates, like we just talked about in the previous video, for indirects are, a male who's, let's say, bald, who doesn't really, care about where the incisions are and wants the best result. You can consider a direct brow lift for this as well. So that concludes our brow lift series, the introduction plus the 5 techniques. Again, as you can tell, not one size fits all. We're gonna keep that theme up as we do all these educational videos, and it's good for a surgeon to be able to have in his or her armamentarium the ability to offer the patients all these different techniques based on how you age, based on your anatomy, based on your goals. So I hope this was helpful. Thanks so much for tuning in.